Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about staffing a clinic appropriately. Staffing a medical clinic is a very tough balancing act. You have to ensure that you have enough staff in order to be efficient and for patient safety reasons. However, it is easy to overstaff and affect your financial budget in a negative manner. Today, we're going to discuss some of the ways that you can avoid overstaffing, as well as provide some ideas on how to do that. First, let's start talking about why staffing appropriately matters. Well, basically, the biggest reason is patient safety, and then a very near second reason is the financial impact. Salaries for staff are one of the largest expenses in a practice. There's no way around it. It's just the reality of how things are. Again, patient safety is an issue, and depending on which specialty you are, it might be an even larger issue than some other practices. The balancing act of ensuring that you have enough staff but not too many staff is, for one, if you overwork your staff, you have a patient safety possible issue there, but your staff get burned out and you could have a patient satisfaction issue there. But on the other hand, if you are overstaffed, it might look like you are offering great service and things are going well, but in the long run, your financial impact is very dire. One of the recommendations I have to see exactly how well you are currently staffed, if you're operating already, is to do a work in motion study with your existing staff. This would be a daily, weekly, and monthly overview because their tasks are possibly going to be different day to day versus every week versus every month. Chances are that is very good. So you want to see exactly what they're doing and look at your work instructions or your SOPs to make sure, one, they're following all of them, but two, are they taking longer than expected? A work in motion study would have them record how long it takes them to fulfill their different duties on a daily basis, weekly basis, monthly basis, depending on their responsibilities. I would not let them know why you're asking them to do this. I would just ask them to provide that information, and then you can analyze it afterward. With technology growing in the medical realm, we have a lot of software that should be able to assist us with the scheduling as well. Between your EMR with the scheduling of your practitioners, and then the scheduling software for HR with payroll and things like that, you should be able to see where things are overlapping, if people are working longer hours than they should. Maybe they're getting overtime that's not approved, or you don't have a policy yet to approve overtime and people are taking advantage of it. But also you might be able to tell if people are coming in late that shouldn't be, or if you need to extend hours in places where it's busier and you don't have enough staff. It's not always that you have too much, maybe you have too little. And that's why these recommendations are suggested so that you can find that middle ground. Once you do these analysis, hopefully you can come up with a staff ratio to your clinicians or a staff to provider ratio that will allow you to be better at scheduling and to be able to budget appropriately as well. Not only do providers and clinicians need a staff member usually to work with them on the medical clinic side, but you also need to anticipate the administrative side as well. This checking in, the checking out, possibly prior authorizations, referrals, things like that, and who would be doing that in your practice for that clinician. You would have to take all this into account when you are doing your analysis and when you're coming up with your final numbers. One of my favorite solutions to understaffing and not overstaffing and finding that balance is to cross-train staff. Now, you're probably going to hear some belly aching from your staff, but it's really important, especially in small private practices. I was very forthcoming with the expectation when I would interview staff. I would tell them that in our practice that everyone helped everyone and we were a team and people were cross-trained with the expectation to be able to fill in during crunch times. There were times where the medical assistant would come in early to room the first few patients because the provider wanted to start earlier than the rest of the clinic, and they would check in the patient appropriately at the front desk. They would know what it means to check their insurance, to make sure everything's updated in the system, to collect any copays or cost shares that were responsibility of the patient before they roomed them. This is not an unrealistic expectation. However, it can be difficult to get staff on board with this if they have worked at other entities in the past where they had very specific and focused responsibilities that did not overlap into other departments. With all of these big conglomerates and entities that are hospital affiliation clinics and things like that, they hire just medical assistants or just registration staff or just front office staff for check-in and just staff for checkout, and not all the way across the board. However, I have found that to be a challenge as a hiring supervisor myself, where asking staff to do this, they kind of look like a deer in headlights, like they're scared, they're unsure, wondering why I'm asking them, why I'm telling them that's how things operate. With the pendulum now swinging back the other way of private practices becoming more common, I hope and have a feeling that maybe this is getting better, but you have to be aware of this while you're staffing and interviewing to make sure that you are very forthcoming and upfront about the expectations, what needs to be learned, what they would be expected to do in crunch time or when you're scheduling, and giving them the tools and trainings they need to feel confident when they have to fulfill those roles. If they're not doing it regularly or often, you might even need to do periodic retrainings and refresher courses with them so that if they do get asked, they feel more comfortable and willing to help you out. As an office manager, I always had monthly meetings, and during those meetings, I wanted input from my staff. This is a perfect opportunity to ask for their productivity input. How are things going? Are they feeling overwhelmed? Obviously, you're not going to be taking just that information and running with it. You also have to do your own analysis and observance to see if what they're saying is backed up on what you're seeing. Maybe you're running reports, you're standing by quietly in the background to observe and watch them do their jobs. Perhaps you have other people helping you watch and putting in their 2 cents and observations on staff and their responsibilities. You can't just take everything based off what the staff is saying. However, it is important to consider that information if you're going to need to make changes in the practice. It might not seem like a big change, but cutting back an hour of one staff member's time per week or per day could have a huge financial impact depending on how much you pay that individual and how little perhaps return on investment you're getting for that extra hour of them working. This is where you would have to do some number crunching when it comes to salary versus what the duties are during that time frame that you would be cutting them out of the practice, and to see if someone else can absorb those responsibilities efficiently and not jeopardizing any patient safety situations. But you could see a benefit in the financial outcomes by making these cutbacks. There are a lot of moving parts to this. However, the more you do it and the more comfortable you get with your staff and their responsibilities and workflows and expectations, the easier it will become. In conclusion, balancing your staffing in your practice to ensure that you're having good patient quality care provided at the same time as watching your bottom line financially can be difficult. However, if you cross-train your staff, you do regular monitoring and reviews of existing workflows and hours of your staff, asking for input from your staff and providers on how they're feeling, the observations they're making, things like that, you'll be able to find a happy medium. Remember that If you have staff that are scheduled a certain way, depending on the time of year, you can change that as well. It doesn't have to be a permanent change to their schedules. If it's a slower time of year for your practice, then communicate to your staff that there might be some cutbacks. But then when you get to the busier time of year, you might expect them to work extra hours. People have to be flexible, but the communication is the key from the administration and management team to the staff. If you can try to be upfront and forthcoming with expectations when it comes to staffing and hours and cross-training, when you interview your staff that you are trying to hire, that is going to set you up for more success than just trying to drop this on your staff without any preparation or further conversation about the reasons why. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.